Throughout history, many societies have dealt with different plagues and diseases, from the early Justinian plague to the current coronavirus crisis. As the world tries to handle the current COVID-19 pandemic, it's important to understand the fundamentals of the problem. Whether it's CNN or Fox, BBC or NBC, news about the coronavirus is spreading like wildfire. In this video, you'll learn about what makes a pandemic, how pandemics are caused and spread, how some earlier societies dealt with pandemics, and current strategies being used to track a pandemic. So let's dive right in.
The media often throws around terms such as outbreak, epidemic, and pandemic without any real care, meaning that the definitions of all of these words are always confused. So let's start by defining them all. First, let's start with endemic, which you may not have heard before. Endemic means that a disease is at the predicted or normal level for that time and in that area. So an example is chickenpox in the United States, which occurs every year and is under control and happens at a predictable rate. Similarly, but slightly different, is hyperendemic, where a disease is persistently at high levels in a certain area. An example of this would be malaria in Africa, since 93% of worldwide deaths from malaria occur there. So malaria is at a high level in Africa, but is still predictable and contained to mainly one location, so it's hyperendemic. Going up the scale now, when a disease reaches levels higher than predicted in an area, it's called an outbreak. An epidemic has a similar definition to outbreak, but it's a more sudden increase in a slightly larger area. Then, when an epidemic spreads across geographical boundaries to different populations around the world, it's declared a pandemic. Other good terms to know are sporadic, which means that the disease occurs randomly or infrequently, and cluster, which means that there are many cases of a disease in a certain place at one time. But the World Health Organization and other scientists have explained that these lines are often blurred, so each disease has to be taken individually and case by case based on the threat and urgency that each presents.
Pandemics are usually caused by a novel infectious agent, an infectious agent that is newly capable of spreading rapidly, or both. Typically, a pandemic is caused by a new virus strain or subtype that becomes easily transmissible between humans, or by a bacteria that becomes resistant to antibiotic treatment. A pandemic can also be caused by a virus's ability to spread rapidly. Humans aren't likely to have an immunity against a new virus. Often, new viruses are discovered in animals before they're discovered in humans, or before any humans have had any contact with it. Yet, if the virus mutates and becomes transmissible to humans, that can easily cause a widespread pandemic. One of the reasons why viruses can cause such deadly epidemics is that some viruses mutate abruptly every so often due to the occurrence of an antigenic shift. Antigenic shift is defined as the process by which two or more different strains of a virus combine to form a new subtype, having a mixture of the surface antigens of the two or more original strains. Now, you may have heard a lot about flattening the curve recently. Most pandemics follow an exponential growth curve. In the early stages, they will slowly rise, suddenly hitting an exponential incline, hitting a plateau at the top of the curve, and then finally coming back down with decreased cases. The CDC uses multiple classification methods to understand diseases and track their progression. Disease event classification is used by the CDC to understand the level of disease occurrence. This is based on the pattern and speed by which a disease moves, known as the reproduction rate, or the size of the susceptible population, known as the critical community size. The CDC also uses a pandemic intervals framework to provide a timeline for health officials on what steps to take based on the global state of the disease. There are 6 phases of a pandemic recognized by the CDC. Those are the investigation interval, the recognition interval, the initiation interval, the acceleration interval, the deceleration interval, and the preparation interval. The first phase, the investigation interval, deals with the identification and research of a new type of virus that may have implications on human health. Then, the recognition interval occurs if and when increased cases or clusters of cases are identified, along with an increased potential for person-to-person transmission. Next is the initiation interval, when cases of the virus are confirmed with both efficient and sustained person-to-person transmission. These 3 phases are designed to help public health officials know when it's time to develop the tools and action plans to respond to an impending healthcare threat. Phases 4 through 6 are when action plans are implemented in coordination with the WHO, also known as the World Health Organization. Phase 4 is the acceleration phase, when public health officials begin to take measures such as closing schools and non-essential businesses, as well as encouraging social distancing. This is the phase the US is currently in with their action against the COVID-19 pandemic. Phase 5 is the deceleration interval, which occurs when there's Phase 5 is the deceleration interval, which occurs when there is a consistently decreasing rate of cases in the United States. Finally, Phase 6 is the preparation interval, occurring after the pandemic has subsided, as public health officials continue to monitor the crisis and brace for another wave of the illness. You can read about the CDC's pandemic intervals framework in the link located in the description. Or, if you're looking for more of a high-level overview on pandemics and epidemics in general, go ahead and check out the article my colleagues and I just wrote on understanding the fundamentals of the COVID-19 crisis.
There have been countless epidemics and pandemics throughout history, but let's talk about some important ones. The Justinian plague, which was similar to the bubonic plague as they were caused by the same bacteria, the Spanish flu of 1918, and the current HIV crisis that began in the 1980s. And it's also important to note that most epidemics and pandemics are zoonotic, meaning that they start when a disease is spread from animals to humans. First, the plague of Justinian was a pandemic that spread throughout the Roman and Byzantine empires, and it was started when rats with fleas on merchant ships infected humans. And this plague, scientifically called the Yersinia pestis, was bubonic, and it originated in China and India in 542 CE. And during this time, the main treatment was home remedies, so 30 to 50 million people died, which was about 25% of the population. The later bubonic plague, better known as the Black Death, was also a pandemic that spread throughout Europe and Asia in the 1340s, and it was caused by the same bacteria from rats as the previous plague. And this bacteria is airborne, and the treatment was unsanitary and dangerous, ranging from bloodletting to superstitions to bathing in rosewater or vinegar. And therefore, this plague killed almost a third of Europe's population, with the death toll totaling 20 million people. HIV originally transferred from monkeys and killed millions, but today many don't know if they have HIV due to unrecognizable symptoms. But there are many ways now to currently quickly test, and we have antiretroviral therapy, which has slowed down HIV numbers. The Spanish flu of 1918 and HIV in the 1980s are more recent, but still have disastrous outcomes. The Spanish flu, also called influenza, was a global pandemic caused by an H1N1 virus that originated from birds and infected about 500 million people. There was no vaccination, so during the crisis, people focused on isolation and hygiene, which was more effective than some previous treatments. And HIV, which is in the United States still currently, affects millions, but it's treated as an endemic now because it's predictable and happens every year. Based on previous epidemics and pandemics, we can recognize patterns and create ways to predict future outbreaks when they happen. An SIR model is one very math-based way to predict epidemics and pandemics, using the idea that over the time of a pandemic, the number of people who are susceptible to this disease, infected, and recovered changes. Assuming everyone is part of one of the three groups, we can use derivatives to track the rate of change and to predict whether or not an outbreak will increase to epidemic or pandemic levels. Basically, by comparing the number of infected people and the rate of change that it's rising to the normal levels during an endemic, we can predict the changes based on external factors such as quarantining, discovering a vaccine, or increasing hygiene, for example, to figure out what's going to happen next. Also, by understanding past pandemics and epidemics, we can learn more about previous treatments and systems placed that failed to compute the best and worst case scenarios for our current situation. Learning the facts about some of these epidemics and pandemics may seem boring in history class, but truly understanding them can help us prepare and solve our current problems, since history always repeats itself.
Although pandemics, especially the one we're dealing with right now, may make us feel helpless to fight against, there are actually so many ways that you can do your part to prevent others and yourself from getting or spreading this disease. The biggest way that you can help those most vulnerable to the crisis is through social distancing. Social distancing is defined as deliberately staying at least 6 feet away from other people while in public, or just staying home to avoid contact with others. Consistently washing your hands with soap and water for at least 20 seconds after touching different surfaces can also prevent the spread of the virus, as well as not touching your face with your hands and practicing good hygiene techniques like covering your cough or sneeze with your elbow. As this crisis continues, hopefully you can refer back to what you learned in this video and share it with others to help them better understand what a pandemic is. If you enjoyed this video, please like and subscribe to my channel, where I post videos on everything from neurotechnology to nanotechnology. Also, go ahead and check out Ria's channel, listed in the description below, where she has some really cool videos on gene editing. Thanks for watching and stay safe at home.